Hello everyone. Today's class is on psychotropic drugs. By definition, psychotropic drugs are substances that will affect your psychological function, behavior, or experience. Broadly, they are classified into antidepressants, neuroleptics, and hallucinogens. Psychoactive drug classification is they are classified into sedatives like alcohol, barbiturates. They could be stimulants like amphetamines, methylphenidate, etc. They could be opiates like morphine, methadone. They could be hallucinogens. They could be marijuana. They could be major tranquilizers like chlorpromazine. They could be antidepressants like the tricyclic antidepressants or monoamine oxidase inhibitors. They could be antimania drugs. Today's class is on methamphetamine or amphetamine. Their mechanism of action is that they will increase the synaptic concentration of neurotransmitters like dopamine, norepinephrine, especially by inhibiting the reuptake of norepinephrine. They will cause increased release of catecholamines, which is responsible for all their actions. Their euphoric effect is similar to cocaine, but they are actually 10 times more potent than cocaine. This is one of the drugs that will stimulate both cardiovascular system as well as central nervous system. Their actions usually last for like 10 to 16 hours, and they order of frequency like mostly people use that as oral form, or they could be injecting themselves with this drug, or they could be smoking it. Actually, when you take this drug, you don't get fatigued easily, so you do more tasks, you do more things, especially in late night parties where people keep dancing all day. They use this drug, especially for rave parties and all. And symptoms could be classified into acute and chronic, etc. So in acute toxicity, the symptoms are similar to that what you see in cocaine intoxication. If it's mild, they will be just restless, insomniac, they will be talking, and they will have tremors and dilated pupils. In moderate, you will have mostly cardiovascular symptoms like hypertension, tachycardia, or it could have sweating, hallucinations, vomiting, hyperactivity, etc. In severe cases, you will see delirium, convulsions, arrhythmias, coma, etc. In acute intoxication, it will cause paranoid hallucinatory syndrome. It will be similar to schizophrenia. Suddenly, the patient will die by stroke, seizure, or due to the arrhythmia. In chronic worsening, we will see amphetamine psychosis. So the person with amphetamine psychosis will have so much compulsive behavior, they can't control themselves, they will be having paranoid personality and delusion of persecution. Delusion of persecution means the person will think that someone's there to harm them, or like someone is waiting to kill them or something. And they will have hallucinations, especially visual hallucinations, and they might have cardiomyopathy or intracranial hemorrhage. So we treat them by doing gastric lavage, acidification of urine, and symptomatic treatment will give like if there's convulsions, we will give antiepileptics for arrhythmias, antiarrhythmics, and so on. And we'll give chlorpromazine for psychosis. Actually, fatal dose is 150 mg to 200 mg. Sorry guys, it's wrong in the slide. Actually, in postmortem appearance, you will see everything similar to that of asphyxia, and in chronic drug users, you will even see myocardial fibrosis. Actually, medico-legally, its importance is that in chronic use, when they withdraw, patient might, the victim might kill himself, and it might lead to suicide. And sometimes long-term use, as we know, will cause dependence and tolerance also. Actually, amphetamine could also be called liquid gold. 40% of amphetamine is excreted unchanged in urine asses, so they will sell this urine, and that urine is called liquid gold. And there are other derivatives from this drug also: methamphetamine, dextroamphetamine, and fenfluramine, phenetramine, mephenetramine, methylphenidate, and synthetic amphetamines. The dangers of misuse is like they will exhibit bizarre behavior, no, psychosis, violent aggressive behavior. These abusers of amphetamine are called speed freaks. They will often exhibit like very bizarre, very aggressive behavior. They might undergo shock and collapse, and there is also a risk of suicide during the withdrawal phase. Thank you guys, that's it for today.